I'm Dr. Michael Harrison, and today I want to share something that could make a real difference in your life. In fact, what we're going to discuss together over the next 30 minutes might be the most important health information you ever learn. Let me start with a story that still stays with me after all these years. I was in my second year of practice when I got called to the emergency department for a consultation. A woman named Eleanor, 73 years old, had collapsed in her kitchen while making breakfast for her husband. Her husband, Frank, had called 911 immediately. The ambulance took 8 minutes to arrive. 8 minutes, that's not unusual. That's actually pretty good response time for most areas. But here's what made the difference. Frank was a retired firefighter, and in those 8 minutes he didn't just stand there panicking. He gently guided Eleanor onto her side, positioned her body in a specific way, kept her airway open, and talked to her calmly until the paramedics arrived. When I saw Eleanor in the hospital later that day, she was awake, alert, and already asking when she could go home. The emergency physician told me something I've never forgotten. He said her husband did everything right. If he hadn't positioned her correctly, we'd be having a very different conversation right now. That was nearly 4 decades ago. And in all my years since then, I've seen this pattern repeat itself hundreds of times. The people who survive those critical minutes before help arrives aren't necessarily the healthiest or the youngest. They're the ones who knew what to do, or they had someone nearby who knew what to do. I remember thinking back then, why don't we teach this to everyone? Because the truth is, emergencies don't wait for professionals. They happen in kitchens and bathrooms. They happen when you're alone with your spouse. And in those moments, the person standing closest isn't the ambulance crew, it's you. Before we go any further, I want to be clear about something important. While I'm a physician sharing evidence-based information developed over 40 years of clinical practice, this video is for educational purposes only. It's not a substitute for personalized medical advice from your own doctor, who knows your specific health history. Always consult with your healthcare provider before making any changes to your health regimen. That said, let's get into it. Today I'm going to walk you through the number one position that could literally save your life or the life of someone you love during an emergency. It's called the recovery position, and while emergency medical professionals use it every single day, most people outside of healthcare have never been taught how to do it properly. Here's what we're going to cover together. I'll explain why body positioning matters so much during those critical first minutes of an emergency. Then I'll walk you through exactly how to perform the recovery position step by step in a way that anyone can follow. After that, we'll discuss the situations where you need to modify this technique or avoid it entirely, because knowing when not to use something is just as important as knowing how to use it. And finally, I'll share what you should do while waiting for help to arrive once someone is positioned safely. By the time we're done, you'll have a skill that most people don't have, a skill that could genuinely save a life. Now here's what most people get wrong about emergencies. They think survival depends entirely on how fast the ambulance arrives. And yes, speed matters. Of course it does. But research from the European Resuscitation Council tells us something even more important. What happens during those minutes before professional help arrives often determines the outcome more than anything else. Let me explain why this matters so much for your body. When someone collapses or feels faint, what's really happening inside is what I used to describe to my patients as a silent emergency. The heart is struggling to pump blood upward against gravity, and the brain, which is the most oxygen-hungry organ in your entire body, starts losing its blood supply within seconds. That's when people turn pale. That's when they get dizzy. That's when they lose consciousness. Now here's the part that surprises most people. Our natural instincts in these moments are almost always wrong. When someone feels faint, their instinct is to sit up or lean forward. When they see someone collapse, most people try to prop them up against a wall or put a pillow under their head. And these instincts make sense from a comfort perspective, but from a survival perspective, they can be dangerous. When you sit up or slump forward, you're making your heart work harder to pump blood uphill to your brain. You're actually worsening the very problem that caused the collapse in the first place. And if someone is unconscious and lying flat on their back, their airway can become blocked. Their tongue can fall backward. If they vomit, which happens more often than people realize during medical emergencies, that fluid can go straight into their lungs. So gravity, the same force that keeps us grounded every day, becomes your enemy in an emergency, unless you know how to turn it into your friend. There's a condition called orthostatic hypotension. It's a fancy medical term, but all it means is that when you change position too quickly, your blood pressure drops temporarily. Your nervous system, especially as we get older, sometimes reacts a little slower than it used to. This is why so many seniors experience dizziness when they stand up from a chair or get out of bed. It's not weakness, it's simply how the body works. And knowing that your body can recover if you give it the right support, that's incredibly empowering. You learn to work with your body instead of against it. This brings us to the first and most important point I want you to understand today. The right body position can literally buy you or someone you love extra minutes of life. In my 40 years of practice, I've seen this principle save more lives than I can count. Not complicated surgeries, not expensive medications, just simple correct positioning that anyone can learn. Let me tell you about a patient I'll call Robert. Robert was 68 years old, a retired postal worker who lived alone after his wife passed. He came to see me for routine blood pressure management, nothing dramatic. But during one of our appointments, I noticed he seemed anxious about something beyond his usual concerns. When I asked what was bothering him, he told me something that broke my heart a little. He said, "Doctor, I'm terrified of falling and not being able to get help. I'm terrified of just lying there waiting to die." That fear, the fear of being helpless during an emergency, is something I hear from so many of my patients, and I understand it completely. It's valid, it's real. But here's what I told Robert, and here's what I want to tell you right now. You don't have to be helpless, even if you're alone, even if help is minutes away. There are things you can do, positions you can put yourself in, that dramatically improve your chances of being okay when help arrives. Robert learned the recovery position that day. He practiced it at home on his soft carpet. And 3 years later, when he had a fainting episode in his bathroom, he knew exactly what to do. He got himself down to the floor safely, positioned himself on his side, and waited calmly until his medical alert device brought help. The paramedics told him later that he'd done everything right, and Robert told me at his next appointment, with tears in his eyes, that he finally didn't feel helpless anymore. That's what knowledge does. It transforms fear into readiness. And I want to share something else with you. This technique I'm about to teach you isn't something new or experimental. It's been used by emergency medical services around the world for decades. The European Resuscitation Council has published extensive guidelines on it. The American Heart Association recognizes it. Hospitals use variations of it every single day when stabilizing patients after surgery, stroke, or trauma. In other words, this isn't Dr. Harrison's personal theory. This is established medical practice that has saved countless lives. I'm simply translating it from medical jargon into something you can actually use at home. Now let me walk you through exactly how to do this. Whether you need to position yourself or help someone else, these steps will guide you through it. The key is to think of 3 words: low, open, and supported. I want you to remember those 3 words because they capture everything you need to know. Low means getting down to the floor or a firm surface. If someone feels faint or is losing consciousness, guide them down gently. Never try to keep them standing. Never try to walk them to a chair. Lying down allows gravity to actually help circulation instead of fighting against it. Open means keeping the airway clear so breathing can continue without obstruction. This is critical because without air, nothing else matters. Supported means positioning the body so it's stable and won't roll in a dangerous direction. Here's the step-by-step process. First, if someone is conscious and feeling faint, help them sit down first, then guide them all the way down to lying on a firm surface. If they're already on the ground or have collapsed, that's fine. Work with where they are. Second, and this is important, gently turn them onto their left side, not flat on their back, not on their right side, their left side. Now I know what you're thinking. Why specifically the left side? It's simple physiology, and it's something I explain to patients every week for decades. When the body lies on the left side, the heart and major blood vessels align in a way that helps blood return to the heart more efficiently. It also keeps the airway naturally open. And critically, if the person vomits or coughs, the fluid drains safely out and away from the throat instead of back down into the lungs where it can cause choking or aspiration pneumonia. Third, once they're on their side, bend their top knee and bring it forward to stabilize the body. This prevents them from rolling onto their stomach or back. Think of that bent knee as an anchor keeping them securely in position. Fourth, position their arms for stability and comfort. The lower arm, the one on the ground, should extend straight out from the body. The upper arm can rest with the hand tucked gently under their cheek for support. This creates a stable, secure position that allows clear breathing. Now here's where I see people make the most common mistake: the head position. Many people instinctively try to tilt the head way back or shove a pillow underneath. Both of these can actually make things worse. Tilting too far back can paradoxically block the airway, and pillows can flex the neck in ways that restrict breathing. Instead, what you want is a slight chin extension. Imagine creating a gentle curve from the chest to the mouth so air flows freely. Keep the mouth slightly open if possible. No pillow needed. Stability and airflow are your priorities, not comfort. And if you need to help someone who can't move themselves, here's the technique that works even if you don't have much strength. Guide by rolling their shoulder and knee together as one unit. Move slowly. Speed isn't important here. Control is what matters. You're not in a race, you're creating stability. Once they're in position, check their breathing. Watch the rise and fall of their chest. If they're breathing normally, keep them exactly where they are and stay beside them until help arrives. Let me also mention something that comes up a lot when I teach this. People ask me, what if I make a mistake? What if I do something wrong? Here's what I tell them, and it's something I want you to remember. In an emergency, doing something is almost always better than doing nothing. If you get the person down safely and positioned on their side with their airway open, you've already done the most important things. You don't need to be perfect, you need to be helpful. The human body is remarkably resilient when it's given basic support. Open airway, stable position, someone present and watching. Those three things cover most of what matters in those first critical minutes. So don't let fear of making a mistake stop you from taking action. The biggest mistake is freezing and doing nothing at all. Now I want to pause here and remind you of something important. I'm not suggesting you make any changes to emergency protocols your doctor has given you without speaking to them first. What I'm sharing today may inform a conversation with your doctor, but your specific health situation might require modifications. Always discuss emergency planning with your healthcare provider. Let me tell you about another patient who illustrates why this matters so much. I'll call her Margaret. Margaret was 75, a retired school teacher who lived with her husband William in a small ranch house. She had a history of occasional fainting spells related to her blood pressure medication. We'd adjusted her doses, but these things can still happen. One evening, Margaret stood up too quickly after dinner and felt the room spin. She knew immediately what was happening. She'd felt this before, but this time, instead of grabbing for the table or trying to sit back down, she remembered what we'd discussed. She told her husband, William, help me down, and together they got her safely to the floor, onto her left side, with her knee bent and her airway open. William stayed calm beside her, talking to her gently, until the episode passed. When Margaret came to see me the following week, she told me something that stuck with me. She said, for the first time, I felt like I was in control of what was happening to me. Even though my body was doing something scary, I knew exactly what to do, and that made all the difference. That's what I want for you. That sense of control, that knowledge that transforms a terrifying moment into something manageable. Now here's the part most people miss, and it's crucial. The recovery position is powerful, but it's not right for every situation. Like any tool, it has to fit what's actually happening. Let me walk you through the modifications and exceptions you need to know. If the person stops breathing or has no pulse, do not place them on their side. This is critical. You need to start CPR immediately on a flat, firm surface. The goal shifts from stability to revival. Position is for breathing. Compressions are for no pulse. Remember that distinction. For someone showing signs of a heart attack, meaning chest pain or pressure, especially if it radiates to the arm, jaw, or back, we modify the position entirely. Instead of lying on the side, keep them semi-reclined at about a 45-degree angle. Think of a recliner position. Back supported, knees slightly bent. This eases strain on the heart and improves oxygen flow to the cardiac muscle. If they're conscious, tell them to stay as still as possible and breathe slowly. Moving around or lying completely flat can actually worsen the pain because the heart has to work harder. Think of this as the heart-sparing version of the technique. For stroke symptoms, the side position is appropriate, but with one crucial modification. Position them on the side of the body that is not paralyzed. This protects the airway if swallowing is weak on the affected side. Keep the head level, never tilt downward, and loosen any tight collars, scarves, or belts. The brain is fighting for blood flow, and the less compression or restriction, the better. For breathing difficulties like COPD, asthma, or chronic bronchitis, lying flat or fully on the side may actually worsen oxygen intake. Instead, keep the upper body elevated. If they're on the ground, prop their back against a wall or stable furniture. Let them lean slightly forward with arms resting on their thighs or a pillow. This posture naturally opens the chest and diaphragm, making each breath easier and more effective. And one more situation that's absolutely critical. If there's been a fall or any possibility of spinal injury, do not roll the person at all. Keep them flat where they are. Stabilize the head by placing your hands gently on either side without moving it, and wait for trained help. Any movement could worsen unseen damage to the spine or spinal cord. I know that's a lot of information and it might feel overwhelming, but really it comes down to this. the basic recovery position works for most situations involving fainting, collapse, or loss of consciousness. You modify it for heart symptoms, stroke, or breathing problems, and you avoid it completely when there's no pulse or possible spinal injury. If you're ever unsure, the 911 operator will guide you. Tell them exactly what you're seeing and they'll tell you what to do. That's what they're trained for. I also want to mention something that many people don't think about until it's too late. Your home environment matters. Take a moment to look around your living space. Are there clear pathways to get someone to the floor safely? Many homes are cluttered with furniture or rugs that could trip someone, or tight spaces that would make it difficult to help someone into the recovery position. A few small adjustments can make a big difference when seconds matter. Now let me address something that I think is just as important as the physical technique. What do you do while waiting for help to arrive? I've seen so many well-meaning family members make mistakes in these moments, not because they don't care, but because panic takes over. So let me share what I've learned from 40 years of treating emergency patients. The most important thing is presence over panic. Once the person is positioned correctly, your job is to observe, not overreact. Check their breathing every 30 seconds or so. Watch the rise and fall of their chest. Don't rely only on sound because some breathing is very quiet. If their breathing becomes shallow, irregular, or stops, gently roll them onto their back and begin CPR if you're trained. If you're not trained in CPR, the 911 operator can walk you through hands-only CPR, which is chest compressions without mouth-to-mouth breathing. It's simple and effective, but if they are breathing normally, your job is simply to stay present. Keep a calm hand near their shoulder or upper arm, not on their face or neck, just that warm, reassuring presence of another human being nearby. Here's something that might surprise you. Research from academic medical centers, including work published by physicians in Tokyo, has shown that patients who receive calm verbal reassurance during emergencies actually maintain steadier heart rates and better oxygen levels than those left in silence. Your words matter. Your presence matters. Your calm matters. Talk to them gently even if they seem unconscious. Tell them you're there. Tell them help is coming. Encourage slow breaths if they're conscious. That quiet connection keeps stress hormones down and helps the brain conserve precious oxygen. And there's practical preparation too. While you're waiting, gather any medications they take regularly. If you know when the episode started, note that time. Note what symptoms appeared first. Was it chest pain, dizziness, slurred speech? Did they lose consciousness? Write it on a piece of paper or just keep the pill bottles ready. When emergency responders arrive, hand that information over first. It can save critical minutes in diagnosis and treatment. In an emergency department, minutes matter, and the information you provide can help doctors make faster, better decisions. There's another thing I learned over the years. The emotional impact of an emergency doesn't end when the ambulance arrives. Both the person who experienced the episode and the person who helped them often need time to process what happened. If you or someone you love has an episode and you use the techniques from this video, take some time afterward to reflect. Talk about it with your family. Share what worked and what felt challenging. That conversation becomes part of your preparation for the future. I want to tell you about one more patient, because his story captures why all of this matters so deeply. I'll call him James. James was 72, a former engineer who prided himself on being self-sufficient. After his wife passed, he lived alone in the house they'd shared for 40 years. His daughter lived 3 hours away and worried about him constantly. James came to me for routine care, nothing urgent, but I could see the same fear in his eyes that I'd seen in Robert and so many others, the fear of being alone when something went wrong. I spent extra time with James that day. I taught him the recovery position. We practiced it right there in my office on the exam room floor. We talked about what to do if he felt faint. We talked about his medical alert device and made sure he understood how to use it. 6 months later, James called my office to tell me what happened. He'd been getting ready for bed when he felt his heart racing and his vision starting to tunnel. He knew the signs. Instead of trying to make it to the phone, instead of panicking, he got himself down to the floor next to his bed. He positioned himself on his side. He pressed his medical alert button, and then he waited, breathing slowly, staying as calm as he could. The paramedics found him exactly where he should have been, positioned correctly, breathing steadily, conscious and oriented. His daughter told me later that the paramedics said, "Whoever taught him what to do probably saved his life." That wasn't me. That was James. He learned something once, he practiced it, and when the moment came, his body remembered what to do. And that's what I want for every single person watching this right now. I want you to have that knowledge in your body, not just in your mind, because here's what I've learned in 40 years of medicine. In emergencies, the body doesn't rise to the occasion. It falls to its level of preparation. If you've practiced something, even once or twice, your body will remember. If you haven't, panic takes over, and panic is the enemy of survival. So here's what I'm asking you to do after this video. Practice the recovery position once, just once. Do it on a soft surface like carpet or a yoga mat. If you have a partner, practice on each other. Learn how to roll gently from your back to your side. Learn how to bend your knee for stability. Learn how to position your arms. If you live alone, practice how to get yourself from a standing position down to the floor safely. Practice how to get from sitting on a chair down to the floor. These aren't complicated movements. They're simple things that become automatic with just a little repetition. And remember, this isn't just about surviving. It's about preserving your dignity. It's about maintaining your independence. It's about knowing that even as you get older, even as your body changes, you are not helpless. You have agency. You have knowledge. You have power over your own survival. Because aging doesn't take away strength. It simply asks us to use it more wisely. And knowing how to protect yourself while waiting for help is one of the wisest forms of strength there is. I think about all the patients I've treated over the years, the ones who thrived in their 70s, 80s, even 90s. They weren't the ones with the most money or the best genetics. They were the ones who took ownership of their health. They learned, they adapted, they refused to be passive recipients of whatever life threw at them. This recovery position we've discussed today is a perfect example of that ownership. It costs nothing, it requires no equipment, but it puts you in the driver's seat of your own emergency response. Let me bring everything together with the key points I want you to remember. First, in most emergencies involving fainting or collapse, the recovery position saves lives. Get low, get on your left side, keep your airway open, and stay stable. Second, modify for specific situations. Semi-reclined for heart symptoms, opposite side for stroke, elevated upper body for breathing problems, and no rolling at all if there's possible spinal injury. Third, while waiting for help, stay calm, stay present, and stay observant. Your reassurance matters. Your preparation matters. The information you gather helps the medical team help your loved one faster. And remember, this information is meant to educate and empower you, not replace the advice of your personal physician. Take what you've learned today and have a conversation with your doctor about what's right for you in your specific situation. If you found this helpful, if you learned something today that you can use, I'd really appreciate it if you subscribe to this channel. I release new videos every week specifically designed to help people like you understand your health in ways that make real differences in your lives. And I promise to always give you the science without the hype, the practical without the panic. I'd love to hear from you in the comments. Tell me, have you ever been in a situation where you wished you'd known what to do? Or maybe you have a story about how quick thinking helped in an emergency. Those stories matter. They help others learn. And I personally read every single comment. Coming up next, I'm going to share something that builds directly on what we covered today. Once someone is positioned safely, there's a specific breathing pattern that can help stabilize the brain and body while waiting for help. It's gentle, it's quiet, and it's more powerful than most people realize. That's exactly the kind of knowledge that transforms fear into readiness. For now, I want to leave you with this thought. You don't have to be a doctor to save a life. Sometimes you just have to know how to position one. Sometimes the greatest act of help isn't dramatic or heroic. It's calm hands, a clear mind, and a steady heart. In my 4 decades of treating patients, I've seen ordinary people do extraordinary things, not with medical equipment, not with years of training, just with simple knowledge applied at the right moment. That's what I've tried to give you today. A skill that costs nothing, requires no equipment, and could mean everything when it matters most. Take care of yourself, and take care of each other. Here's to your health.